Welcome everyone to the August 2025 meeting. Really, really excited to share some good stuff with all of you. As you know, we have three names for our website: Modified NOTA, End Kidney Deaths, and End Kidney Deaths Act. The majority of Americans have stated their support for compensating donors. And there have been four surveys of the transplant community that also indicates that they support compensating donors. So we just need to get this to the finish line because we do have majority support. And all of these surveys can be found on our website. So the lobby day will be Wednesday, October 22nd in Washington, D.C. I'll send out the survey again if more of you want to join us. And this is an opportunity to speak in person with leaders. It was a very effective lobby day last September. We also will arrange for a lunchtime briefing with hopefully staffers attending and perhaps having congressional members speak during the briefing at lunchtime. We've celebrated 100 media stories about the End Kidney Deaths Act, so this is really excellent. We've had actually 106 so far since we had that 100 announcement. 6 more have been printed. And today alone, we had 2 excellent media stories. The first one was by advocate and community member Debbie Kahn, a kidney donor, and the Niskanen Center also did a great story. Now, this is very big news, the mass exodus from organ donor registries following media coverage. This is an absolute catastrophe for the over 100,000 Americans who are dying while waiting for an organ. It's unclear the extent of what's going on, but it is causing people to panic and remove themselves from being organ donors. This makes the End Kidney Deaths Act even more necessary than ever. And so I've been writing to congressional leaders, making the connection between the already scarce supply of organs becoming worse and the need for the End Kidney Deaths Act in order to return to a level of a supply of kidneys and really to course correct, if at all possible, from this catastrophe that seems to be causing thousands of people to remove themselves from being on the deceased donor registry.
Elaine, quick question. Was that in
Absolutely.
response to the Kentucky issue?
Absolutely. Yeah. It started, I think that was the initial story. And since that point, there was a big article in the New York Times. It was picked up by Reuters. This is a Newsweek story. I think this story, I'm just listening to a podcast that Mark Scotch gave me to listen to. The extent of the media coverage is wide. This was sort of an urban myth that organs would be taken from people before they're fully deceased. And it turns out that perhaps is happening. I did hear from a physician at the World Transplant Congress that all of these reports are false. And so, you sort of don't know what the truth is, but the reality is definitely that people are removing themselves from the donor registry, and it is a tragedy. We have 4 new co-sponsors this month: Representative McBride from Delaware, Fushi from North Carolina, Malloy from Utah, and Goose from Colorado. We have a total of 29 co-sponsors. Our pace has slowed of getting new co-sponsors, and that concerns me. We do have 3 on deck who haven't yet been listed. I'm very proud. Representative Espiat I'm a constituent of Representative Espiat in New York City. He's come aboard. Representative Houlihan from Pennsylvania and Representative Tlaib from Michigan. Now, I just want to emphasize, I know Bob is on the call, and I'm not sure if Michelle Hughes is on the call. Bob Gutman and Michelle Hughes did an excellent job persuading Representative Fushi to become a co-sponsor. This did not happen overnight. This was months and months of labor by the constituents in Representative Fushi's district. And I just want to share with you one email that Bob sent out with some details. This is one of many. In order to get your representative to be a co-sponsor, sometimes an op-ed will do it, sometimes a conversation will do it, but more often an intensive amount of work goes behind that. With Representative Espiat, I met with the office about 4 times, and I was writing to them all the time to try to get them aboard. So it takes work to get these co-sponsors on the bill. Representative Houlihan is another example. We had Greg Hess working hard in Pennsylvania, getting Representative Houlihan excited. This is the first Pennsylvanian that we have as a co-sponsor. Now, with Representative Malloy, a Republican from Utah, I was delighted with the staffer's email to me. He wrote that it's my favorite bill that I've ever worked on. And so, this is an indication that this bill is popular. We just need to put the energy in to get it across the finish line. But one of our biggest issues is that organizational opposition continues. I know, and it was confirmed for me, that the National Kidney Foundation and the American Society of Nephrology are definitely behind closed doors telling people in both the executive branch and the legislative branch to not support the End Kidney Deaths Act. And this is so frustrating because we know that not only will their constituents benefit from this legislation, they also are in favor of the legislation. So the leadership in these organizations are not representative of the will of the majority. And powerful organizations actively oppose change, mostly, I would suspect, to preserve financial arrangements that benefit from the shortage. As we know, $37 billion, up to $37 billion will be saved by the End Kidney Deaths Act. That's coming out of certain people's wallets, and they do not want their wallets to become any thinner. And so that's a big source of the opposition to the End Kidney Deaths Act. One thing that did happen that was very encouraging was that I asked 100 donors to sign a letter to the American Society of Transplantation, asking them to really follow the lead of their constituents. They had a 2009 and a 2015 survey of their constituents in which the majority stated support for compensating donors, and yet they've created this 15-person task force that is going to issue a statement about compensating donors. I'm very concerned about that. And so having the 100 donors sign the letter was something that I think was quite effective. We did hear from the president, who wrote just an email saying that basically he received the email with a couple other details. I then asked for a meeting because we were both at the World Transplant Congress and did not receive a reply. So I was very busy this month. I was first in Washington, D.C. The first thing I did, it was a huge honor. I went to a party, a cookout hosted by Martinez Majors Sr., who is on this call. We celebrated Martinez's life, and I spoke with his potential donor, his sister, and I'm very hopeful that Martinez will be transplanted ASAP. After that, both Lindsay Gutierrez and I danced in front of the White House and handed out flyers and tried to bring some attention to the amazing End Kidney Deaths Act. As many of you know, Lindsay is both a liver and kidney donor to strangers. She is an Air Force veteran. She was Miss Veteran America and Miss Achievement America, and she's just been an amazing advocate. After that, I had 6 congressional meetings and in-person meetings, which was wonderful. And then the Niskanen Center, a think tank in Washington, hosted a wonderful happy hour about organ donation policy. And I got this amazing shot of 8 organ donors. To the far right is Cecilia Esterline, who is an altruistic liver donor. After her father passed from liver disease, she gave her liver to a stranger. And then we have a bunch of others. Just to say, it was a terrific group of people and really, really an enjoyable experience. Next, we have also in attendance at the happy hour is Sally Satel, who's been a heroic advocate, a double kidney recipient, and she's written extensively about organ compensation. She wrote an entire book about it, When Altruism Isn't Enough. And Alan Viard both work with the American Enterprise Institute, and both of them have written about our legislation. And I really love this picture. I like to call people where the couple are both donors a power couple. Both Martin and Annabelle have given their kidneys to strangers. Annabelle was a miracle match for someone who wouldn't have matched with most people on the planet. So just wonderful work. And this is the essay that I'll share with you that just came out today from the Niskanen Institute of the think tank, Saving Lives and Money by Incentivizing Living Organ Donation. This article is about the End Kidney Deaths Act, and it's really superb. After DC, I headed over to the World Transplant Congress in San Francisco. It was a huge honor to have a long walk with Al Roth, one of our big proponents who fortunately created the algorithm so that we could have kidney chains. I also got a chance to meet with, these are all supporters of the bill, Dr. Anthony Watkins from Tampa General Hospital, and he is a transplant surgeon. Arthur Mattis and Frederica Ambachir, both were my co-authors on the JAMA letter to the editor. Arthur is a transplant surgeon and Frederica is a criminologist and an expert on the underground illicit market. Then we have amazing advocates and kidney donors, Betsy and Peter Snow. They're wearing the End Kidney Decide t-shirt. And then we've got Heinrich, who came in for handing out flyers, and we had so much fun. Bob Montgomery, transplant surgeon from NYU, another supporter. And Chris Klug was the keynote speaker, and he's also a supporter as well as his foundation of the End Kidney Decide. He's a liver recipient, and he went on to earn, I think, gold medal in the Olympics after receiving his liver transplant. So an amazing athlete. Had a great dinner with Lori Lee, who made the Abundant film and does the Donor Diaries podcast. There's Betsy and Peter Snow, who we saw earlier, and Philip Held, who's written extensively with Frank McCormick and other authors about the kidney shortage. He's a kidney researcher. I hired people to hand out flyers at our event, which was a good idea because it gave us a really solid presence in front of the convention center. Here we have other supporters, John Campbell and Mike Lalo, both gave kidneys to strangers. And here we have Lila Cray, who's on the call, and she also came and helped us get the flyers out to the participants. There were 6,000 of them at the World Transplant Congress. Here's another supporter, Louis Mayan. He's a recent kidney donor. And here we have Tom Peters, transplant surgeon, who has served in 3 wars and is a big supporter of the End Kidney Decide with Frederica. I'm also part of the Transplant Collective. Here we have Jen Benson and Lorraine and Emily, people who have either given or received organs. Now, something that is uncomfortable for me to talk about, but it's just unfortunately a harsh reality. I've been doing this work for a couple years now, and I've been supported by very generous people, but the money is running out by October. So I don't like to ask people for money, but I am starting a GoFundMe. My salary is $75,000 a year. I don't have any benefits, so it's just the salary. I really need to raise about 90 grand to take me to the end of the next congressional session, this congressional session, which is December of 2026. My contributors so far are Betsy and Peter Snow, Ned Brooks from the Coalition to Modify NOTA, Scott Suskin, I got an ACX grant from him, as well as Josh Morrison and Thomas Kelly from Waitlist Zero. And so I'll be sharing the GoFundMe link with you and hoping you can help. I really am committed to doing this work. And, but you know, you gotta buy food, right? So that's also true. Now, I've had a bit of a shift in my thinking. And that is, I was very happy to just chug along on the with both the House and Senate. By the way, Senator Moran is the committed Republican co-lead that has been confirmed for me last week. We still need to find a Senate Democrat to join him. I'm really working hard on this. If you can help me with if you have Democrat senators, let's get somebody to co-lead with Senator Moran so we can get this bill introduced in the Senate. But back to this idea of focusing on the executive branch. Once I learned that we have multiple organizations working against us behind closed doors in Congress and with the executive branch, it made it clear for me that we really need to target for our messaging, President Trump. And that's because he's going to be the person who's ultimately going to sign this bill into law. And he's already demonstrated in 2019 with his kidney executive order that he is devoted to helping increase the number of living kidney donors. Now, when he passed the executive order in 2019, the bureaucracy did not implement what he wanted in the way he wanted it to be done. He wanted our country to provide more access to living donation and make it easier for living donors to afford to donate. Unfortunately, he was mostly thwarted in that effort by the bureaucracy. It is very frustrating. And so I'm very hopeful that President Trump will see this as something that he really wants to shepherd to the finish line. This is really, really amazing legislation. I was doing some research. In terms of legislation that saves both lives and money, we can offer lead pipe replacement and tobacco legislation. There's not much in the way of policy that has achieved this goal, and I do think that he will be a supporter, but we need to get his attention. So how can we do that? The methods are going to be social media engagement, particularly with Twitter or X. direct outreach to the White House and key officials, leveraging community and media networks, and amplifying through personal and public connections. Now, with our Twitter strategy, the timing is going to be critical. We want to post tweets about the End Kidney Deaths Act. This is something I'm going to be working on immediately after something comes out from the White House or from President Trump himself. Use our hashtag End Kidney Deaths Act and try to get, if you are on Twitter, more of us doing this, not just the End Kidney Deaths Act site would be great. But we really need to catch the eye of his team. We need to directly write to the White House about the End Kidney Deaths Act. We're also going to start a petition, and that will, I think, also potentially be helpful. Continue to focus op-eds on Congress, but also include President Trump. So, for example, I just submitted an op-ed to the Times-Picayune from New Orleans, and I included President Trump, a plea to President Trump to help us out, along with the senators and the House members from Louisiana. We're going to build momentum, and we're going to demonstrate how the End Kidney Deaths Act aligns with President Trump's priorities. Now, President Trump cannot issue a tax credit. That is something that only Congress can do, but he could potentially do an executive order helping, going from a different angle to compensate donation. We're going to need you to do some advocacy this month. I will be sending directions in my follow-up email.